Good morning, everyone. Thank you for joining us today for the 2024 Canadian Ehlers-Danlos Syndromes Conference, Understanding EDS and HSD Symptomology, Diagnoses and Treatment, a guide for primary care practitioners and physician specialists. My name is Virginia McEwen, and I, along with Dr. Roland Beaulieu, am a co-chair for this year's event. So just a little bit about myself. I am a family physician with a focused practice in chronic pain from Thunder Bay, Ontario. I currently practice pain medicine at St. Joseph's Care Group, as well as at the Thunder Bay Regional Health Sciences Centre across a broad spectrum of pain conditions, of course, of which hypermobility and EDS is a part of that. I do consider myself a pain generalist, and I use tools that range from pain education, lifestyle teaching, medical management of pain, sleep, and associated mental health conditions. I also have a robust spectrum of interventional pain care options under fluoroscopic or ultrasound guidance, which ranges from regenerative medicine to radiofrequency ablation. Professionally, I keep myself busy with trying to advance certain pain care options in Northwestern Ontario. So I'm currently piloting a multidisciplinary pediatric pain program, of which also there's some hypermobility kits. To hopefully advocate for the needs of children who have limited access to care in the North. And I'm also developing relationships with my palliative care colleagues to provide interventional options to cancer patients who have pain refractory to conventional approaches. So I feel blessed to have a very unique practice with a cradle to grave sort of perspective. I'm involved in several research grants, sit on several chronic pain advisory committees. I'm an assistant professor at the Northern Ontario School of Medicine University, and I regularly host learners who are interested in pain medicine. In my spare time, I enjoy sailing with my husband and 2 kids in our sailboat in the Maritimes. I like working in my garden and skiing in the wintertime. So, moving on to introducing today's event, we are hoping today we will be able to provide education, including methodologies and tools for both primary care and specialist practitioners around the diagnoses and care of the Ehlers-Danlos syndrome and hypermobility spectrum disorder population. Our goal is actually to develop a toolkit that will enable care providers to better screen, identify, and diagnose patients to inform appropriate treatments and referrals. The EDS Canada Foundation and Scientific Planning Committee are delighted to see and welcome you. For those of you who may not be familiar with this patient population, I'm going to preface today's presentations with a case study to hope that it provides a framework and context around some of the information you'll be hearing today. While patient presentation does vary quite widely in this population, this case study is representative of the complexity of the patient population, the many symptoms and conditions that can manifest, and the all too often delay in receiving an assessment or diagnosis. This happens to be a patient of mine, and I learn from my patients every day, and I continue to work with this patient to try and find solutions to help her manage her pain. This young woman, when she first came to me and we sort of delved into her history, she very typically sort of had that early childhood experience of lots of sprains and strains, noting scars and stretch marks, having lots of balance problems and falls, and kind of clumsy. And was fairly manageable, but then around the age of 14, 15, started developing a lot of gastrointestinal symptoms with bloating, abdominal pain, chronic diarrhea, nausea, started missing lots of school time. So at that point, the usual sorts of investigations looking for celiac and things like that were investigated. She did end up adopting a gluten-free diet. And at that point in time, things were never really quite the same, but things dramatically exacerbated after a car accident at the age of 18. She sustained mild whiplash injuries, but developed significant headaches, vertigo-like dizziness, severe fatigue, neck pain, blurred vision, tinnitus, a hand tremor, cognitive issues, and so on. And the headaches were always kind of one of the most prominent and problematic symptoms. She also had some investigations at that time that indicated she had essential sleep apnea. And at that time, she was also diagnosed with Chiari. About a few years later, she ended up having PRA decompression, and a lot of her symptoms dramatically got better after that. She, around that time, was also diagnosed with hypermobility EDS. So after the Chiari decompression surgery, her headaches went down to only just a handful of headaches per month, and she was able to start returning to work and to more normal life. What was notable after the Chiari surgery, however, was that she started experiencing random bouts of flushing, hives, itchiness, rashes, more GI issues, an increased heart rate, and an intolerance to heat. So this resulted in further investigations and consultations with specialists until she was diagnosed with mast cell activation syndrome. This was back in 2016. Now, unfortunately, in 2016, she had another car accident which re-triggered Chiari symptoms, and now they were much worse. So she started experiencing more symptoms of dysautonomia and had a high resting heart rate. She had worsening GI dysmotility, and the list goes on. She also, around this time, after years of suffering with chronic pelvic pain and dysmenorrhea, had a scope that, laparoscopy that found endometriosis and started working with pelvic floor physio. And around this time, she was found to have a bladder prolapse. She proceeded to have a hysterectomy, but that didn't actually help a lot of symptoms. In fact, it seemed to make her bladder pain worse. So over time, she has been still working on bladder retraining and working with pelvic physio. She's still quite fatigued. And at this time, we are still working extensively on managing her headache symptoms. And as with many of my headache patients, it's not just one headache phenotype. So we're working on managing the migrainous component, the cervicogenic components coming more from the joints of the neck. But then we're also wondering, is there a possibility that she has a CSF leak headache? Or does she also have craniocervical instability? So there's more details in the package that you received with your registration. I think what I would encourage people to take away from that is some of the things that have really been helpful for her, and not just medication, a lot of the therapies that have been helpful, because often when I start working with patients like this, we tend to focus on medications. However, the allied health supports and management is critical. So we hope that through today's educational opportunities, such as those provided by the esteemed experts we're going to be hearing from today, that we can begin to recognize better, understand, diagnose, and manage the often associated conditions that these patients may present with, and thereby improve patient outcomes. I'm now going to turn the floor over to Dr. Beaulieu.
Thank you, Virginia, Dr. McEwen. My name is Roland Beaulieu. I'm a pediatric cardiologist working in Toronto and communities north and east of Toronto, including Orillia, Barrie, Oshawa, and Peterborough. I graduated from the University of Alberta and started my pediatric training there. I recall in my first day in medical school where our dean mentioned that about half of what we learned would someday be found not to be accurate. This set me on my lifelong learning quest. I realized that I could not become too attached to what I learned yesterday, as today and tomorrow could change all that. I furthered my education at Dalhousie's IWK Hospital for Children in Halifax, and then completed my pediatric cardiology training here in Toronto. As anyone who works with children will tell you, one looks after not just the child, but rather his or her whole family and community, or village, as the saying goes. I had the fortune of being invited to the ILC Foundation's annual meeting in 2016 by one of my patients who had EDS and Chiari malformation. I was amazed at the incredible talks given by leaders in genetics, surgery, radiology, mast cell conditions, osteopathy, pain, microRNAs, and more. I was thrilled to hear the news of new genes for hypermobile EDS being discovered by Dr. Norris and Gensemer at the Medical University of South Carolina. Better diagnostic tools and cellular and immunology research will lead us to better therapies. There is hope. I became aware that some of my own family members have connective tissue problems, and so I was committed and motivated to learn and then teach what these great conferences have taught me.